right, I think we're going to start this session. The session is Fatigue, Invisible but Heavy. I'm Janet Poole. I'm an occupational therapist from the University of New Mexico in the USA.
And I am Monica Holmner from Sweden, and I'm here for FESCA.
So we're both the co-moderators, and it's our honor to be here and introduce the speakers today. The first speaker is Dr. Janet Pope. Dr. Pope will talk about the difficulty in measuring fatigue as a symptom and non-pharmacological management options such as exercise. Dr. Pope is the director of the Scleroderma program and professor of medicine at Western University, London, Canada. She is a professor of medicine and rheumatologist at Western University in London, Canada. She's published over 615 articles resulting in research accolades and is a passionate teacher and educator, especially in scleroderma, rheumatoid arthritis, and lupus. She currently co-hosts some of the Around the Room podcasts after having been featured as a regular guest. She has a social media presence on Twitter where her clinical pearls have a reputation of teaching physical findings to over 18,500 followers.
That's great.
Thank you very much, and thank you for attending. I'm always very humbled to see so many people coming who have experienced systemic sclerosis or their loved ones are living with it. We'll be having a little bit of overlap as we go, which I think is good, and also we'll have lots of time, I'm hoping and thinking, for Q&A at the end. So this is a topic that when we poll patients, fatigue is one of the number one symptoms, not the only one, but one that's quite problematic for people. So these are my disclosures. So this is just to tell you a lot has gone on in fatigue. So I pulled Dr. Poole. So I'm Janet Pope, she's Janet Poole. We both do research in systemic sclerosis. But just as an example, fatigue in systemic sclerosis, more than 16 peer-reviewed articles, and scleroderma for Dr. Poole is 60 or more articles. And I will briefly talk about some of the newer released non-pharmacologic recommendations for the treatment of both scleroderma and lupus. So when we're talking about measurement, these are all the areas with somewhat validated scores, and there's even more coming as we speak. So really from the organs, work disability, swallowing, chewing, oral opening, hand disability, sexual health, fatigue that we'll talk about, pain, fibrosis, the GI tract, Raynaud's, general and specific quality of life. So there's a lot we can measure, and needless to say, as a patient suffering from scleroderma, you don't want us measuring all this stuff at every visit. But we do it for research, and we do some of the measurements routinely as well. So to talk about fatigue, first of all, it is very common. It's due to multiple reasons, and sometimes we don't know the reason, but there are reasons that we could find and treat. So low blood, meaning anemia, that could be low iron from bleeding in your gut. Your swallowing tube could have erosive esophagitis. You could have watermelon stomach, so bleeding from telangiectasia in the GI tract. Inflammation can give anemia of chronic disease, so especially when your disease is quite active. Pain certainly is strongly linked with fatigue. Poor sleep for multiple reasons, including the disease. We'll talk about that. Depression, having pain and suffering and a diagnosis, and you go to the internet and read about it and it gets very fearful. That can make people feel very anxious and depressed. And then the strain, it's harder if you feel like your hands are in cement or your body's in cement. It's harder to actually do things. So just to do getting up, getting dressed, maybe no longer working or going to work, buying your food for the week. All those things can take a lot of energy when your body isn't working right. So how do I ask about fatigue? So we're lucky because we're in a university clinic where we do clinical care and research. So every patient at every visit, they just sit and they're trained to do a bunch of forms that we give them that help us make the encounter, I hope, more holistic. So one question we ask every patient with systemic sclerosis, but every patient coming to clinic at every visit: how severe is your fatigue, we say, over the last week, from 0, not at all, to 100. And that gives us an idea of where people are at. So this is just looking at 100 patients with scleroderma, and the fatigue, 100 is the worst ever, 0 is none. The mean fatigue at one point in time was about 50 over 100. At another point in time, about 50 over 100. So fatigue is very common and moderately severe in a lot of people. You can see it's correlated with sleep, with the global assessment of their visual analog scale, and pain. So all these line up together, not in every patient, but on average. So it's cumbersome. My fatigue is 0 usually. So to have a fatigue of 40 out of 100 or 50 out of 100 is pretty high fatigue. So we also are trying to think at a visit to manage scleroderma, and it is complex. All those organs involved, where I showed you all the various measurements we can do, these are the types of things we're thinking about. And at every visit, I'm not going to be talking about everything, obviously. So in general, this is probably a tip that you might have already learned. First of all, the doctor or the nurse's agenda is often, okay, are you taking your meds? Do you need a refill on the prescriptions? Are you getting the monitoring? What do I need to order? When are you coming back? So our agenda is very different from your agenda. Your agenda might be, I have a lot of pain, I'm worried, I think I might be clinically depressed. When do I get my breathing tests next? So it's probably a good idea to write down 1 to 3 things that you want to discuss. Don't write 10, because you probably won't get 10 answered, but write down the top ones. You can write down 10, but the top 3 things I'd like to discuss are, and make sure that you have time in that encounter with the physician or the trainee, whomever, to say, here's my agenda. Thanks for doing yours and looking after me, but here's my agenda. So I think that helps set the stage of what we should talk about, because you're not going to want to talk about everything at every visit usually. So if you prioritize, I usually say, now what can we maybe discuss and possibly help you with? So have that conversation. So I did talk a little bit about causes of fatigue. I'm trying to just hone in more. So low blood, and that could be from the various parts of your scleroderma that are bleeding. But for young women, it could be heavy periods, totally not related. It could be an ulcer because you're on an anti-inflammatory, like a naproxen or ibuprofen drug, an NSAID. Disease activity, especially early on, your body and your mind haven't adjusted yet. Some people have terrible itch and can't sleep at night, especially when their skin is early on worsening or progressing. Some of the medications can cause fatigue, so not everyone tolerates drugs such as mycophenolate mofetil. Some are tired on it. Methotrexate, if you have inflammatory arthritis, or sometimes for the skin to try to soften it, can be quite fatiguing for some people. So we're trying to sort out the fatigue when people tell me about the fatigue. Poor sleep, and there's treatable causes like sleep apnea. If it's due to anxiety, depression, fear, worry, there's ways of helping treat that. Chronic pain, of course, can cause poor sleep and fatigue, or just fatigue, and comorbidities. So some people have long COVID, and so they're exhausted. Maybe they have other comorbidities. Their thyroid is over or underactive. That can be fatiguing. Or maybe there's something like diabetes and the blood sugars aren't good. So we're always trying to think of what's causing it, what might be treatable. And that's how I look at it. There's also, so I published this as a framework in rheumatoid arthritis and just changed it for this purposes to scleroderma, because the framework also exists in scleroderma. So the fatigue could be from the scleroderma disease. It could be from patient factors, the pain, the mood, the poor function. It takes so much energy to do things. Poor sleep, personality and expectations. So we have some people that get a diagnosis of scleroderma and rightly or wrongly think, oh my goodness, I am doomed, my life will never be the same. And there's other people that go, I'm not going to read about it, maybe that's good, maybe that's bad. So we all have different personalities and there's a whole spectrum. And expectations, if I set expectations that I want you on a medication, I expect you to only be 25% better, you're not going to expect to be 100% better then. So I don't have a cure, I don't have a home run for most patients. So the expectations are, I try to get them set so we can say, did it work or not? And then other patient factors, so even lifestyle, some people before they have a chronic disease are working 125% of the time. And once you have a chronic disease, you have to dial that in often. So trying to fit your lifestyle to be good to yourself, not just your family, to say no to your family, to be good to yourself. So you have to set expectations at home too. I sometimes write a prescription saying, I can no longer cook all the meals that I give the patient to tell their family. Look, at the doctor gave me a prescription. I can't do it all. I need help. Now, presented at this conference is a poster from one of my colleagues in Canada, Dr. Mohammed Osman, and he has looked at a novel marker for fatigue in scleroderma patients, and this might give hope that there's something we can address later. This marker was found in scleroderma patients. It's higher if there's bad fatigue, but it's also found in patients with, for instance, long COVID, chronic fatigue, fibromyalgia with a lot of fatigue. So this marker might be something that we can change over time. So it's just the first look, kind of exciting though. So things that we do, so pain, we're usually saying rank your pain, 0 to 10 or 0 to 100. We're looking at function, and that way I can also look and say, is your fatigue strongly related to this, or your fatigue's really high and your function's not too bad? So what else is going on? So there's some of the things that we would do in practice, those visual analog in our health assessment questionnaire. So there's a lot of different scales, and there's no one scale that is good for every study. So lots of different ones, and it's kind of overwhelming. We're not going to ask every patient these scales except for doing research. And so a common one in research is the Functional Assessment of Chronic Illness and Therapy Fatigue Scale, and that's called FACIT. And it's, I feel fatigued, 0 to 4. I feel tired, 0 to 4. So some of it's a bit redundant, and you can see the frustrated at being too tired to do the things I want to do. So it's not just fatigue, it's the impact of fatigue on your life. So this is one that is commonly used in studies, but there's a lot. So it doesn't matter which one we're using, and sometimes we're using a couple of them for research. And this is a nice study that came out back in 2018, and you can see function is spread throughout. That's the HAQ disability. It goes from 0 to 3. You can see that there's problems all the way along for individual patients. But look at fatigue. Hardly anyone has 0 on fatigue, and a lot of people have a high fatigue level. So that's where that arrow is, right looking here at this. There's a big range of fatigue, and it's correlated with a range of how are you feeling on physical function, somewhat correlated on how are you feeling on mental function, so the mental and the physical components. But fatigue has a broad range and is a problem in a lot of people suffering from scleroderma. This is another way to look. This is the distribution of fatigue. So this is the worst, this dark color here, and you can see the dark color here, but even quite a bit. So very much, quite a bit, somewhat. All these people are suffering in here on these questions. Hardly anybody has, well, most people fortunately aren't too tired to eat, but hardly anybody has really low fatigue in scleroderma patients. And this would be a usual set of clinic patients that agreed to do this research. Now, Dr. Poole and others have looked at principles of non-pharmacologic treatment in scleroderma and lupus, and a lot of the overarching principles are a shared decision. What's bothering the person living with the disease, and how do we think we can help them? And to understand that this is not in lieu of or in replacement for the other, say, prescription medications. Then there are recommendations. Some of these recommendations are highly evidence-based. That's the level of evidence, which I cut that part off the graph, and other ones are make good common sense, but not as much data in the literature. So we want to prevent flares. Maybe we should look at various treatments of good lifestyle, exercise, etc., trying to get better sleep hygiene, things like that. So this is data, so this is not yet published, so it's unpublished data, but we did this study during COVID, so who knows, but our COVID kind of messed up our follow-ups like it did every single trial, but we had a single blinded study of looking at whether or not high dose vitamin D, 50,000 units once a week, or regular dose vitamin D. So if a patient was on 1,000 units and they were randomized to low dose, we'd say, oh, try 2,000 units. If they were on no vitamin D and they were randomized to normal dose vitamin D, we'd say, why don't you try 1,000 units a day? But what we did was we said, you know, vitamin D is good for your bones, might or might not be good for scleroderma. It's been used high dose in some other studies. So we didn't tell anybody that this had anything to do with fatigue. And we had ethics approval, of course, IRB to do this. So we randomized patients to high dose vitamin D or normal dose vitamin D. We had their fatigue scale because we collected at every visit. And then around 6 months later, at a usual visit, we collected fatigue again. Well, some of our visits during COVID became phone call visits. So sometimes if the trainee was doing the phone call, we had to phone back and say, tell us about your physical function, tell us about your fatigue. We had to get the scales that they usually did in clinic before we saw them. So, you know, it's not the best methodology, but it's the best we could do. And so what we found is overall, fatigue doesn't budge very much. So we found if the normal baseline fatigue, because we only looked at patients 4 out of 10 or more, so it was 6.4 approximately out of 10, or if we want to convert it, 64 out of 100. And then on follow-up, group 1 was just randomized to their normal dose vitamin D. It stayed around 6 or 60. It went to 5.9. In group 2, it was a high-dose vitamin D, and the patients honestly didn't know why I was prescribing it, which is okay, because it was blinded to, because if I said, this will really help your fatigue, we can get a bit of a placebo effect, so we didn't do that. But you can see on average the score went down, if we go 68 to 53, it went down about 15, and that would be a clinically relevant difference, and that's the average. So some people it didn't change, most people it didn't worsen, it was already bad enough, but some people it really did improve. It was statistically significantly different. We're still working on this. And my impression is, so this is not what I'm recommending for everybody, but it's pretty safe. It's good for your bones, and as long as you have okay kidney function. What we found, at least clinically, my impression is maybe 15 to 25% of people, high dose vitamin D, 50,000 units once a week. It could be vitamin D2 or D3, because one's always on back order, at least in North America. What we found was that fatigue can improve in maybe 1 in 4 people suffering from scleroderma. So it's something to think about. It's not yet peer reviewed. We haven't submitted it yet, but something that's kind of easy, pretty safe, and usually isn't going to hurt anybody.
And
so,
time.
Oh, time? Oh, sorry, I saw 2 minutes, sorry. We're set wrong. So these are just how to improve fatigue, if you want to take a picture, helping fatigue, some tips, and thank you. So sorry, I was watching this clock. All right, thank you very much.
Thank you, Janet. And I want to introduce Rong. How does fatigue impact patients? How can we measure the impact of fatigue? Rong is co-chair of Education Committee, APLAR. Rong is a professor and director of the Department of Rheumatology and Immunology in Peking University Third Hospital. Her research interests include understanding the pathogenesis of fibrosis and autoimmune inflammatory diseases, both from the basic laboratory perspective and pro-inflammatory molecules and cells, and using a translational medicine approach for the therapeutic utility. Welcome.
Thank you so much for having me here. I'm probably the first Chinese rheumatology to present in the patient forum, so honored for that. And the organizer asked me to introduce a little bit about how to measure fatigue in lay language. I say yes, because my English is just let me to speak very simple things. So no worry about the sophisticated things. I will introduce this in a simple way. So this is my disclosures. So fatigue, as mentioned previously, is actually a very common non-specific symptoms experience, I think, by everyone. So especially in the pandemic, I think nearly everyone experienced fatigue. So that's, I think, maybe a good thing for the rheumatologist that can understand how the patient feel. That's quite a good thing for us. Fatigue is symptoms that characterized by a feeling of exhaustion or lack of energy. You can see from the this year's poster, there's some research about loss of energy. So it's a kind of equal things. And also another important thing is fatigue can reduce the capacity in functioning. That is also very important because it's really related to our daily life and the quality of life. Actually, there's no standard definition for fatigue. It's always present as different ways, like a sense of tiredness, I feel lack of energy, a feeling of exhaustion. So another important thing is to try to find the relationship between avoidance and fatigue. For normal people, health people, if you feel fatigue, if you have enough sleep and rest, and the fatigue will recover. But for patients with chronic disease, even if you have enough rest, the sense of fatigue is still going on. So the prolonged period of rest may not increase the help with the fatigue. So I would like to use the word pathological fatigue. So if you have enough rest, you still have the sense of the fatigue or exhaustion, then the fatigue may need to be helped with. So actually the fatigue is quite common in patients with scleroderma. From the literature, we found the prevalence is around 61 to 90. So there's a big variation among the prevalence. This is partly because the researchers use the different scales or measures to measure the fatigue. So the fatigue is also present by different complaints. For example, the muscle pain or feel frequent colds and extra. So fatigue is kind of symptoms that quite difficult to measure. But some researches showed us that the severity of fatigue is related to the disease severity. So if you look at the data from the paper published last year, so you can see when the disease activity is heavier, then the fatigue scale is greater. So that must be something related with the disease and fatigue. One of the potential mechanisms is inflammation. You can see that in inflammatory disease like scleroderma, the disease may produce a lot of pro-inflammatory cytokines like IL-6, etc. And this will lead to fatigue through different ways. Besides the disease factors, you can also find there's another things. So fatigue is quite complicated symptoms result from different pathogenesis. So, for example, from our patient, we found that the malnutrition can lead to high grade of fatigue and other symptoms. So that's why I think that's important for us to collaborate with nutritionists to resolve the symptoms of the fatigue. And nearly every research showed us that the fatigue is related to the quality of life and also physical function. And from recent publication, we found that fatigue is also associated with social participation. So it's not only relate to the physical function, it also relate to social function. So that's another thing we need to pay much attention for. And there's a different aspect of the impact of fatigue, including work disability, increased cost of illness, and etc. And you can see from this figure that there's so many things relate to fatigue. So fatigue is quite an important thing for us to deal with. To deal with the fatigue, we need good tools to measure fatigue. You can find that more than 10 tools or measures to tell us how severe the fatigue is. You can say that simple ones like VAS fatigue. That's just one measure, and you can see there's a difference from the recall period. For VAS fatigue, normally the researchers or the doctors will ask you, during the last week, how do you feel? And there are another scales, and you can see the different questions and also recall periods. I will not go into much detail into this, just to let you see what we do in our clinic and researches. And for brief fatigue inventory, you can see the normally recall period is past 24 hours. And for fatigue F, we use 13 items, and recall period is a preceding week. And there's fatigue function and also other multi-dimension scales like calendar fatigue scale. Its recall period is a preceding month, and multi-dimension assessment of fatigue. We use 15 items. The recall period is a preceding week. And other things, you can see there's different scales. I would like to see that scales is all being validated in different diseases. For scleroderma, these 6 tools has been used, and they all being proved to have good reliability. And some of the scales are too simple, and some are too complicated. So I think the different scales can used for different researches depending what you want. A good thing is these scales has been used for clinical trials during the last decades, and you can see from the Fascinate study, which is showed the safety and efficacy of tocilizumab in patients with scleroderma. And you can see they use the facet fatigue score. But unfortunately, by the injection of the tocilizumab, there's no improvement of the outcomes of fatigue at week 24 and also week 48. But there's do some treatment that show the improvement of fatigue, and most of them are non-pharmaceutical therapies like exercise or puncture, something like that. So as still a huge amount of needs for us to understand which kind of treatment is helpful in scleroderma. So I would like to stop here and let you know there's a very important issue of fatigue in scleroderma area, and there's still unanswered questions. And it is also important to explore the potential drug targets for fatigue, and how to measure fatigue is very important for us. So I think maybe we should take the opinions from our patients and their relatives to let us know which one you like and what kind of help you need. So there's still a lot of things we need to do, and studies are also going on for better understand of the fatigue. Thank you for your attention. I would like to thank Alison, Zheng Ai for their help. It's a Chinese organization for scleroderma, Zibeike. They actually help us a lot to understand what the disease is. Thank you so much.
Okay, our next speaker is Annelise Rønnow. Ms. Rønnow is a Danish patient living with systemic sclerosis since 2007. She's been active in volunteering and improving awareness of systemic sclerosis, both at a national and international level, amongst other things, patient advocacy boards, patient expert panels, awareness campaigns, and more. As a professional, she is a librarian working with digital services at the local public library, where she's also teaching high school students how to find information.
Thank you very much. And the last one, helping them finding information, that's quite a challenge, because they all think that information can be found online, and that is not the case. Anyway, so that's not what I'm about to talk about today. I want to thank you for 2 great talks ahead, and I'm happy to stand here talking about what it feels like to live with fatigue and having scleroderma. So it's basically, I wouldn't say that I'm a patient. Well, I'm not only a patient, I'm a person living with systemic sclerosis. I'm someone who's trying to get my way through life cooperating with this she-devil called scleroderma. I know it says life on that. I'm quite busy living my life having this she-devil called scleroderma right next to me. So the fatigue is, as we know, a symptom which can be quite overwhelming that comes along with the scleroderma, and living with chronic fatigue can be challenging both physically and emotionally, and it can affect our everyday task, and even taking a shower can be quite difficult when you have this fatigue that is so coming after you. So if here, this is one, I'm going to give my tips all through my talk here. And if laughter is something that you can cope with or can help you cope with it, I'm quite sure that some of you might use some of the same kind of memes which you can find online on social media, and I'm quite having fun with these kind of things. So I'm so tired that even my tired is tired. That's something that we can definitely relate to when we have this kind of fatigue. For me, it's like living with scleroderma and the fatigue is like having a co-driver. It's like you have this co-driver sitting right next to you, saying in what direction you want to go, and sometimes it can be quite annoying to have this person right next to me saying, "Oh, don't do this today because it's going to be awful." So there are good days and there are bad days, and some days, even weeks, the lovely driver right next to you is not there. But I did not ask for this co-driver, and I know perfectly well how to handle my life as it is. But sometimes she just pops up saying, "Oh, this is too much." So it's all about a balance in a way, and you have the good days and bad days, and when you have the good days, it's just like a walk in the park or driving through the lovely landscape, and everything is just fine. So one thing is that you cannot beat this co-driver, and I think it's quite important that you listen to your body, listen to your fatigue, because we cannot conquer it. And if we're trying to, we know that it is going to be much worse. And then we are starting to feel a little bit stressed and might even feel bad conscience because we cannot go to this party or we cannot go out during the weekday because I have to get up early in the morning. So one of the things is when dealing with this, just trying to be kind. And I know it's very difficult to do that, but it's about trying to work, listen to your body, find the balance, listen to this co-pilot, which you definitely don't want to sit here right next to you, yapping. So it is okay to say no. And I think that many of us can relate to that little word, no. It's very difficult to say no, because we want to do everything. So it's we're trying to do whatever we can in order to keep the co-driver away, because it's about choosing our battles. Fatigue never misses a chance to be heard when, let's say, you're out going to a concert or going to a World Congress for a couple of days, and you know that there are some battles to be dealt with afterwards. But I think it's very important that we choose those battles and participate in things. For my part, I really like to go to a concert, and I know it's going to be difficult the days after, but being in that moment means so much to me because it gives me positive energy, and it can really do a good difference. So my tips for fatigue is, as we have heard already, actually, I'm quite happy that we are on the same page here, is that it's okay move a little bit, move your body. Yesterday we had our session for PAH, and the question arose, what about exercise when it's difficult to breathe due PAH? And actually the good advice was, get a dog, because then you get out and walking. And even a small walk is quite good for you. You can do bicycle. If you have these old Wii games with tennis, it's good too. You can get dancing on Facebook, on YouTube and so on, doing some yoga, stretching. And it's important to drink water. I know personally that is kind of difficult. I always forget to do that. But drinking water, making sure that you are just filled up with that is also giving you more energy. And also listen to your doctor, your physicians, get the right treatment, and do your treatment, because if you're well treated, then you might also be able to get more energy from that part. Healthy eating is very important, and a thing that is a bit difficult for me is that have your regular breaks, and being at still working, can be difficult. If I'm deep inside a project, I forget everything about time. So put a clock and that reminds you of this break. And a good thing is also to plan ahead. Do to-do list. If you're traveling, do to-do list. Quite good time beforehand, because then you have it out of your mind. Get enough sleep. We just heard it. And meditation, mindfulness can also be a great tool for handle the very bad fatigue days. And yeah, we cannot break it, so we cannot defeat the fatigue, and sometimes it's just too overwhelming. And it's okay. It's perfectly okay to be like that. And when I have those days, I'm calling in sick, and then I have those days, they are my Netflix days, because there's no energy to something else than laying on my sofa, having a good cup of tea or coffee or whatever you like, have some fruit, and just binge watch your favorite TV show. I can see there are some nodding here on the behind you, and you are in totally agree with that, and it's okay. But the most important thing is that it's okay to say no. And I think this is something that we all have to work with, no matter what. So yeah, it's just like trying to find the right balance for this. And yeah, that's it. Thank you for your attention.
Thank you very much. And now we have time for questions. Do we have any questions? Yes, over there.
Thank you very much. It was quite informative talk, and the completion of the session with Anna-Marie, it was the personal experience was wonderful. Thank you. Can I go back to to our clinical colleagues and ask? It's good to know that we can measure fatigue. We have different questionnaires, we have different surveys, we work a lot around how we classify fatigue. But at the end of the day, Anne-Marie told us what to do with our everyday life. So can I ask our academic colleagues what you have come to from the pharmacological point of view? We all know that what we need to do to cope with our lives. That's not a very huge problem. But is there anything pharmacologically that can help us? That's important to understand, I think.
So we'll probably both answer something. So a couple things. Mostly, sleeping pills don't help. So mostly, some of the things we prescribe don't put people into restorative sleep. They might knock them out, but it's non-restorative. So a lot of what we do try is healthy living, and you heard some of it. We talked before this started, even breathing exercises, doing them now and then, positive journaling. I was at a lecture recently, and a pain specialist said it's also okay to have your anxiety, your sadness, your madness, and journal that, but only for 20 minutes a day, and then it's dumped out of your mind. That's it. I close the book until another day, so to speak. So you can also deal with it that way. But for medications, sometimes if there is inflammation, so some of our patients will have, say, concomitant inflammatory arthritis. If we can get the pain and the inflammation under control, that will lag behind helping fatigue, but can help it. And it takes longer to improve fatigue than even to improve pain or inflammation in general. If there's really active disease, some of our drugs will help to treat the high skin score and have it regress a bit. Some patients with stem cell transplant, their fatigue is gone, the way their other symptoms improve as well. So there's a broad spectrum of things, but there is no magic pill to say, oh, take this multivitamin or this thing and get your fatigue better, unfortunately. But I'll hand it to you to say, what do you do to tell patients?
Thank you. That's a great question. That one, I think I don't know the answer yet, because for fatigue, I think there's different things we can do, but for drugs, I think you can try like like JAK inhibitor or something else. That's normally some people do, but it's just proved in other inflammatory diseases such as rheumatoid arthritis, but not being proved in scleroderma. So I think it's a long way to go to let us know which drug is useful, but you can understand that you can do in either way, because there's some of the drugs you can avoid to you could avoid to for example steroids. If you stop long-term steroids, then the fatigue may improve. And also like low thyroidism, if you have low thyroid hormones, and then you may take some, and that also can improve fatigue. And for drug side, I don't think we know that much about that. We know that exercise, sometimes acupuncture will help you, and I think a most important thing is just as you said, it's okay. Just relax and accept it. Have enough rest, and then that's it. So I think the most important thing for us is live in hope. I think that will be helpful. Thank you.
As a patient, I can add a little bit to that. It is okay to just say, oh, well, that's it. Because, but it's, I don't know how to express it, but I think that's what is quite exhausting, is that you get frustrated because you want to do all these kind of things and you cannot do it. And then you just go in this kind of circle. So it's about trying to work with your mind. Not that I don't I don't talk it down, or how to say it in English, but I acknowledge that the fatigue is there. I can assure you that tomorrow is going to be my Netflix day. When I get home tonight at 11 o'clock or midnight, or maybe tomorrow is my flight is delayed or cancelled or something like that, because this is what happens to me all the time when I travel. And those who are here, who knows me, they can sign that letter saying, yep, we know about that, because it happens every single time. So my apologies to those who are going on the same flight tonight on KLM to Amsterdam if it's delayed, because then it's my fault. But to handle the fatigue, I know that I addressed it to my physician last time when I went to a checkup, that, oh, I have this fatigue, brain fog, I don't know what it is, and I don't know how to handle it. And it might be because I was in a stressful situation by then, I don't know. But it's just like the seasons. You have the good days and you have the bad days, and we know, we have seen the documents, we've seen the surveys saying that fatigue is number one on what bothers us on daily basis. But this is not what the doctors are focusing on. They're focusing on, so how are your lungs, and how are your kidneys, and how is your digestion, and so on. So yeah, again, as you said, Janet, have 3 points that you want to discuss with your doctor when you go to the next checkup. And it can be the fatigue. And we have to find a solution, how to help us to a better quality of life. Because it is it is quality of life. If we are so fatigued, so tired right into the bones that we don't know what is going on, then we get frustrated. And it's so difficult to handle. So, and also talking to friends, get together with the community, because we can all help each other.
I think the anxious leads to fatigue. Anxious?
Anxiety, yeah. Yeah. You just get down the road if you let it. Yeah.
We have time for one more question. Anyone?
Yes. I have one question for Janet Pope. You talked about the galactic 9 marker. I had to write it down to see if I pronounced it correctly. Is this marker a marker for fatigue itself, or can it be used in other fatigue-related diseases such as pulmonary fibrosis?
So that's an excellent question. So it's my colleague's research, who's an MD, PhD, who's here at the meeting. And my understanding thus far is that it is present in high fatigue conditions that are chronic conditions that have been looked at. So I would suspect, without knowing for sure, that it would be elevated in people with overwhelming fatigue, who have pulmonary fibrosis, who have systemic sclerosis with, say, a high skin score, who have concomitant chronic pain and fibromyalgia, et cetera, because it's been found in other conditions. And I think to find a marker, number one, it helps to validate that there is something going on here. We know there's something, but it's invisible. We've talked about that. It's something that your friends could say, you look well, but you think, oh, I feel like crap, right? So it's invisible. And also because it might be someday a marker that a therapy could help with. We're not there yet, but there's a lot of new innovation that comes along, and fatigue is so common in a lot of our autoimmune diseases that it would be a great help to, I think, study any avenue where we can help people. So great question, thanks.
Thank you. Interesting questions and a very interesting session. One more question. The microphone is coming.
Hola.
Hello? You have talked that there has been studies about vitamin D, but have there been studies about the possibility,
One more time.
una vez más,
Can't
Sí.
hear.
Se ha hablado aquí
you have talked about a study about vitamin D that has not been published yet.
y se ha pensado o se
Have you considered or
Vitamin D. Yes?
sí, sobre la vitamina D. Se ha hablado aquí sobre la vitamina
you have talked about vitamin D, but have you considered the option of multivitamins, for example, for us as patients? Me personally, I take multiple vitamins daily to deal with my fatigue. Have there been studies on this topic, or are they planned? Because we usually talk only about vitamin D.
Yes. The question was, we have studies about vitamin D. We talked about vitamin D, but we also want to know a little bit about supplements, vitamin supplements. Should we use it? Is it good for us?
So we'll probably all possibly answer this. So if a person with systemic sclerosis has lost a lot of weight, because especially their digestion or in the beginning, the inflammation can make some people lose weight, then potentially a multivitamin might be helpful. But in general, for most people that are eating what we would consider your regular country's diet, you probably won't get extra benefit from supplements. So it really depends. Nutritionally, though, we do have some people who, with scleroderma, you can lose muscle mass, and some people will lose some nutrients, micronutrients as well, especially when they're losing weight. But that's not most people with scleroderma.
Thank you. Great question. I think I don't normally measure vitamins in daily clinic. How about you?
So we tend not to measure mineral deficiencies unless if someone's having something like cramps, and then we go with the magnesium or the calcium off. If they have kidney failure or your kidneys don't work right, you can have lots of problems with calcium and phosphate metabolism. So if there's some of these comorbidities, but I don't measure as for instance, like a zinc level or a micronutrient level.
Yeah, so that's a problem. Maybe for patients who have multiple organ involvement, maybe we can measure the vitamins first, and then in patients that with vitamin deficiency, it may be useful. But my suggestion is you'd better believe that's useful. If you believe that's useful, it can be useful. Thank you.
So in other words, if you want to try something at an approved dose, not overdose or anything like that, you try it. If it helps you, use it. If it doesn't, stop. Don't waste your money then. Better money spent, though, exercising, which can be free, mindfulness, which can be free. There's online programs as well to help people for meditation and things. So I'd spend my money on that instead of a micronutrient myself, yes.
Okay, so that's the end of our session, and thank you all for coming, and let's give our speakers a big round of applause for this complex topic.
Now we have a brunch just in the foyer outside this room. Thank you.